additional 3 minutes, so... Anyway, so I am Dr. Monique Mendoza. I come from Nordic Medical Clinic, and I am here to discuss about crew wellness and resilience. So before I begin, can I ask you guys, show of hands? Let me start by asking you a question. On a scale of 1 to 10, that's our favorite question as doctors. On a scale of 1 to 10, 1 being the lowest score, and 10 being the highest score, how good do you feel today? Okay, I'm gonna start with 10. Show of hands. Raise your hand if you identify with the number. 1, lowest score. 10, highest score. How good do you feel today? Okay, let me start with number 10. Anyone feeling a 10 today? Wow. 9. 8. 7. 6. 5. Some are, trying to hide. 4. 3. Come on, don't be embarrassed. 2. 1. 1. None. Wow. 0. Okay, so I started with that one because I wanted to establish how important awareness is. Well, actually, the previous panel have already established how important awareness is when it comes, if we want to be improved or more wise when it comes to whatever it is that we are doing. Self-awareness is actually very vital. Now, the question is, as much as awareness is very important, action is what makes us move forward. That's how important it is. That's what we do with the awareness and the information that we have. So, given that we already know that we are already investing, a lot of money on ship maintenance, trainings for competence, what about wellness? Because without wellness, we wouldn't even have any fit seafarer to get the jobs anyway. Without any fit seafarer, we would be spending a lot of money on multi-billion dollars of investments on ships. How about the people who are manning those big equipment? Crew wellness is very important because a ship is only as strong as its crew. So how are we investing? How much are we investing on the wellness of these people that we are giving the big responsibility of manning the very big things that we are also giving a lot of money on? All right. So the question is, are we merely ensuring that our crew survives, or are we helping them thrive? Okay, so every time that I give a talk, I always try to remind my audience about wellness. Because when we talk about wellness, a lot of people will it comes to their mind that, you don't have any maintenance medications, you don't have any cough or colds, you're automatically a healthy person. But when we talk about wellness, it's actually looking at the person as a whole. There's an emotional aspect, there's an aspect of finance, right? There's an aspect for rest and recreation, spiritual life, personal goals and passion. You need to be looking at the person as a whole, not just the compartmentalized parts. For example, you are sick with your heart. Who do you go to? Cardiologist. If you're sick with your kidneys, who do you go to? Nephrologist, urologist, right? How about if you are sick with your heart, your kidneys, your eyes, your skin, who do you go to? It would be hard to identify unless you would be having, a roster of doctors in your chart, right? You have a lot of doctors in your care. It would be hard if you will just be looking at the person as a compartmentalized set of organs. You need to be looking at the person as a whole. So when we talk about wellness, it should be about the wholeness of a person. It's not merely the absence of disease, and there are different aspects of a person. How about resilience? Sometimes resilience, there are different takes on this particular word. So when I talk about resilience, it's your ability to adapt, recover, and grow in the face of challenges, right? But it's not innate. It's something that you develop through constant and intentional practices, and also through preparation. And according to the American Psychological Association, resilience is deeply connected with resources. So what resources do we have for the people that we are entrusting our ships to? Okay, so for the next set of slides, these are actually some of the practices, good practices that we have been seeing, good outcomes from based on how we did it with one of our big clients. Okay, so when we say building resilience, it's actually a combination of mindset, habits, and support systems. So for the mindset, we need to be establishing first that the person or the seafarer is well or fit for sea duty. In 2023, we published and presented a research, the health risk classification of seafarers. And through that finding, we came up with a certain solution we started developing and implementing for this particular client that we have. So what we did is we created different packages per age group. So per age group, since we have, for more context, I want to share this with you. I have a friend from the ER. So she's a doctor, an emergency med physician. And she mentioned that one of the most unforgettable times that she went on duty was actually when a 21-year-old male, morbidly obese, came in because of stroke. A 21-year-old male with left side already paralyzed. Imagine the quality of life that that person will have for the rest of his remaining days. And I want to emphasize in here, since we are talking about wellness and the beta paradox, the region beta paradox, wherein sometimes wellness is actually not prioritized until incidents happen. Health is not valued until sickness comes. Or at least until when, illnesses on board increase in number, or there are a lot of trends in the medical repatriation and shore consultations for certain, different illnesses that could have been prevented while still on land. So what we did here is we tried to make it more comprehensive per age group based on the data that we gathered, that people are getting younger now. Those who are getting sick are actually becoming younger. The younger the people, they are getting more and more of these diseases that we usually just see in the past in the older people. So we added different tests per package per age group so that we could be more efficient in terms of evaluation and risk assessment. Next one is behavioral counseling. So one other thing that we decided to implement more is, aside from telling the seafarers what they got, or their findings, or their PEME, or the different requirements that they needed to complete, we actually thought that maybe there's something that we can change when it comes to their behavior. So the first part there is actually assessment, self-assessment. And then afterwards is commitment to a certain change, even a small change in their practices. Okay, so with that, at least we are able to educate them properly. A while ago, many times. Empowerment only happens when there is education. And we all know that it's a human tendency, right? That if we don't understand something, we immediately fear it. And sometimes fear can make you, do a lot of things that you didn't think you would even do in the first place. For example, it was raised a while ago, regarding what is a possible reason why we are seeing less deployments among Filipinos. Now, while I don't have the statistics to be presented in my next few slides, it was actually raised in our recent inaugural convention for maritime health physicians regarding ambulance chasing. Now, it's a looming threat for unemployment among Filipino seafarers. The question is, why do they feel like they have to resort to that kind of thing? Especially when they are already afraid because there are already some medical issues or findings that they would rather go for something that's illegal and could compromise the whole industry in the Philippines, because they do not understand what's happening in their body. because they do not know what to do with what's happening in their body. So behavioral counseling and also good guidance from doctors would actually help them be able to be empowered and do something about what is happening in their body. So that's how we can actually help shift the mindset of the seafarers by establishing wellness and helping them through the process. Okay, next one, habits. Motivation gets you started, but it's the habits that keep you going, right? So trainings and reiteration. When we keep repeating different things, different practices, when we continuously keep on talking about things, keep on doing something about it, keep on training people how to do something about it, like inclusion of health and wellness talks for pre-departure orientation seminars. Before they even go and join a vessel, having that kind of reminder that they can actually do something about their health, even if they're already in a certain area or a place wherein they have limited resources, that's actually a big help to them. Crew seminars, when they are on shore, the learning never stops. Right? The training never stops. Training, or at least enlightenment, times for reflection, opportunities for realizations, that's really helpful, especially when you include the family members. Because here in the Philippines, right, we are very closely knit with our families. Sometimes, according to what was shared a while ago, right, so many of the different reasons for utilization of the psychological helpline or the mental helpline was actually because of family problems. Sometimes seafarers ask for help not for themselves, but for their family members. So when you include the family members, you actually give them the opportunity to understand more about what's happening to the seafarer when they are on board. And when they have that kind of understanding, they create better relationships, better mental health for the seafarer. And of course, mental health first aid trainings. That is also helpful when they are equipped with enough information, psychoeducation, right, on how to do it for themselves, how to help themselves. Okay, and then lastly, support systems. So organization initiatives, when you put it in a system, when it's already structured, what happens is that you do not only get individual resilience, but you create a culture and you get community resilience, which is far better and much stronger. Okay, so for example, when you are clear on your protocols regarding zero tolerance and harassment and bullying, you ensure that the people on board are actually not just individually aware of what's tolerable and acceptable, but as a team, someone would speak up. And 24/7 access to medical and psychological assistance, that gives the crew kind of some assurance that even if they are far from their families, that even if they are far in the middle of the sea, they still have an access to someone who could help them regarding the technical stuff, medical, and even psychological. So that's how you give resources to your crew. So for this particular client that we did all these practices, we were able to keep and maintain. So for there's this particular study, regarding repatriation here in the Philippines. And in that particular study, it was found out that in hundreds and thousands of deployments, there's at least 1.4% repatriation rate for all Filipino seafarers that were included in the study. So hundreds of thousands, different clinics, different companies. And this for this particular client, we were able to maintain less than 1% repatriation due to medical illness. Kind of a good metric for us to be able to see if we are doing effective screening and we are able to build at least some form of resilience for them to be able to keep their jobs on board and lessen operational costs. Okay, so at the end of the day, resilience is not just reactive. It's not something that's innate. It can be developed proactively through preparation. Preparation is everything. Much the same as an athlete conditioning himself before the actual contest, right? We need to keep doing it. We need to keep practicing it because in times of crisis, people act in default mode. That is the reason we keep on doing earthquake drills, so that when earthquake happens, we know that we need to dock and take cover. So if ever a crisis happens, like, illness, mental distress, your default mode is already set to you knowing how to take better care of yourself, or at least how to deal with such kind of issue. Okay, so what we want to do is we want our crew to thrive, and the question is, what preparations and resources do we have in place? Because ultimately, a thriving crew means a thriving industry. Thank you.